Understanding dissociative identity disorder. Causes, signs, symptoms, and treatment. Dissociative identity disorder, DID, previously known as multiple personality disorder, is a complex psychological condition characterized by the presence of two or more distinct identity states or personalities within a single individual. These identities alternately take control of the person's behavior and are often associated with distinct memories, behaviors, and preferences. Here's an in-depth look at the causes, signs, symptoms, and treatment options for DID. Causes of dissociative identity disorder. 1. Severe trauma. Childhood abuse. Recurrent and severe physical, sexual, or emotional abuse in childhood is a significant contributing factor. Early childhood trauma. Experiences such as neglect, prolonged stress, or significant disruptions in caregiving. 2. Dissociation as a coping mechanism. Defense mechanism. DID develops as a defense mechanism against trauma, where dissociation helps the person to escape or detach from intolerable experiences. 3. Attachment and bonding issues. Insecure attachment. Problems with attachment and bonding in early life can contribute to the development of DID. 4. Biological factors. Genetic predisposition. There may be a genetic component that increases vulnerability to dissociative disorders. Brain function. Changes in areas of the brain involved in memory and emotion regulation. 5. Environmental factors. Lack of support. Inadequate support systems during and after traumatic events. High-stress environments. Ongoing high-stress or unstable living conditions can exacerbate dissociative tendencies. 6. Developmental factors. Early life experiences. Experiences during critical developmental periods that overwhelm the child's ability to cope. Signs and symptoms. 1. Identity disturbance. Multiple identities. The presence of two or more distinct identities or personality states, each with its own pattern of perceiving and interacting with the world. Switching. The sudden transition from one identity to another, often triggered by stress or reminders of past trauma. 2. Memory variations. Amnesia. Gaps in memory for everyday events, important personal information, or traumatic experiences. Dissociative amnesia. Inability to recall specific details or experiences, often related to the trauma. 3. Depersonalization and derealization. Depersonalization. Feeling detached from oneself, as if observing one's own actions from outside. Derealization. Experiencing the world as unreal or dreamlike. 4. Distinct behavior and preferences. Changes in behavior. Different identities may exhibit distinct behaviors, voices, postures, and preferences. Varying abilities. Differences in skills, knowledge, and even physical capabilities between identities. 5. Emotional symptoms. Severe mood swings. Rapid changes in mood and emotional state. Anxiety and depression. High levels of anxiety and depression are common in individuals with DID. 6. Self-harm and suicidal behavior. Self-injury. Behaviors such as cutting or burning oneself, often as a coping mechanism. Suicidal thoughts. Recurrent thoughts of death or suicide, or suicide attempts. 7. Disorientation and confusion. Time loss. Gaps in time or memory, where the individual cannot recall what happened during a certain period. Disorientation. Feeling confused about time, place, or identity. 8. Functional impairment. Impaired daily functioning. Significant difficulties in managing daily tasks, relationships, and responsibilities due to identity shifts and memory gaps. Treatment. 1. Psychotherapy. Trauma-focused therapy. Addresses underlying trauma and integrates fragmented identities. Cognitive behavioral therapy, CBT. Helps manage symptoms by changing negative thought patterns and behaviors. Dialectical behavior therapy, DBT. Focuses on improving emotional regulation and distress tolerance. Eye movement desensitization and reprocessing, EMDR. Used to process and integrate traumatic memories. 2. Integration therapy, identity integration. Aims to merge separate identities into a cohesive self or develop a functional cooperation between identities. Grounding techniques. Helps the individual stay connected to the present moment and reduce dissociation. 3. Medication. Symptom management. Antidepressants, anti-anxiety medications, or antipsychotics to manage co-occurring symptoms like depression or anxiety. No direct cure. Medications do not cure DID but can help manage associated symptoms. 4. Supportive therapy. Support groups provides a platform for individuals to share experiences and coping strategies. Family therapy involves family members to support understanding and management of DID. 5. Self-care strategies. Stress management. Techniques such as mindfulness, relaxation exercises, and maintaining a healthy routine. Healthy lifestyle. Regular exercise, balanced diet, and adequate sleep. 6. Safety planning. Crisis management. Developing plans to manage self-harm or suicidal behaviors, including emergency contacts and safe spaces. Triggers identification. Identifying and managing triggers that lead to dissociation or identity switching. 7. Long-term support. Ongoing therapy. Continuous therapy is often needed to manage DID and related symptoms effectively. Regular monitoring. Regular follow-up with mental health professionals to adjust treatment as needed. Dissociative identity disorder, DID, is a complex and often misunderstood condition rooted in severe trauma and characterized by the presence of multiple identities within a single individual. Understanding the causes, recognizing the signs and symptoms, and exploring the various treatment options are crucial for effective management and recovery. With appropriate therapy, support, and coping strategies, individuals with DID can achieve improved functioning and quality of life. Early diagnosis and tailored treatment plans are essential for addressing the unique challenges of DID.